Hello, everyone. Thank you for joining the webinar today. My name is Umar Baharom, and I am the Senior Engineer at Standard Imaging. And today we'll talk about the Max HD Phantom for MR-guided SRS QA. So before I go to the next slide, I'd like to remind everyone that today's webinar will be recorded for future review. If you have any questions, please type them at any time in the dialog box, and I will answer them at the end. So just a quick overview of what is SRS. So SRS or stereotactic radiosurgery, two-step process. First, you have to accurately define the shape and location of the lesion in the stereotactic frame with CT of MRI. And then the second is to develop and deliver planned treatment with concentrated dose in the target, which has a steep dose gradient external to the treatment volume. And of course, the rapid dose follow-up is important to spare normal brain tissues. So we understand that SRS delivers single or hypofractionated dose to the patient, and the dose follow-ups are often steep to avoid organs at risk. And in terms of imaging and localization, CBCT is pretty much the gold standard due to superior geometric accuracy, but MR-guided systems are increasing in adoption since it is better in delineating the targets. So with the Max HD Phantom, it's an ideal phantom to use for SRS, regardless of treatment modality. It provides all the tools needed for an end-to-end SRS QA, whether you are starting a new SRS program, adding or updating your equipment, and for regular physics and QA training. Additionally, multiple MET SRS cases are more common now, and we will see how QA can be done for this with the Max HD Phantom. So the Max HD Phantom is a fully anthropomorphic head phantom. It is made of proprietary epoxy resin material, which is stable and machinable. The Phantom has a corona cut, which gives access to the anterior and posterior inserts. We'll look at it in the next slides, as well as a large film bisecting the C-spine. The Phantom was designed to be very user-friendly without the use of any hand tools, and the two halves of the Phantom are securely located on dowel pins. The anterior section of the Phantom can be lifted off using the handholds to access the inserts and film. And the Phantom supports multiple APM-TG SRS testing protocols through using complete end-to-end tests. We have a Winston-Lust test, isocentric verification with the bone. You can localize with the bony anatomy. There's laser alignment as well. You see the laser alignment lines in the next slides. You can also localize and reposition, test for localization and repositioning with the cow shift, as well as patient orientation, image transfer QA, IGRT QA for MR, X-ray, onboard KV, MV images, of course, CBCT as well. It can also be used with optical system or surface-guided radiation therapy, and of course, the MR-CT image fusion for multiple MET dosimetry. So this is kind of the basic workflow for radiation therapy, especially for SRS. The 4 steps are, scan, plan, localize, and treat. For every of these stages, it's very important to do end-to-end, quality assurance. And the Phantom has the role to play in all 4 steps in place of a real patient. So one of the unique features of the Max HD Phantom is that it is visible in both MRI and CT. This is one of the first Phantom to do so, which allows the user to confidently test the imaging and treatment delivery systems for SRS. Of course, the Phantom can be localized with CBCT and other KV or MV imaging system as well. The idea of purchasing an anthropomorphic Phantom is so that the critical bony anatomy are present for localization, dose delivery, and verification. And another unique feature of the Phantom is that it is machined such that all of the inserts and those measurement points have minimal impact on bony anatomy. You see the C-spine is still intact, the way we've machined the phantom. And the anterior and posterior pockets are offset to fit the brain volume. So you can see here, this is the anterior pocket and the posterior pocket. So this is the MR-CT fusion image. Just show you an example. You see how well the phantom resolves in MR. On the right are the fused images, and the MR images are taken from a V-ray meridian. This is a 0.35 Tesla magnet. And then from these images as well, you can see that there are multiple targets where those measurements can be taken for multiple SRS cases. So you see you have the 2 targets here, as well as the film sliced through the C-spine. Here's another one, MR-CT fusion. This MR image was taken on a Electa Unity, which has a 1.5 Tesla magnet. For setup, the phantom can be set up in many ways to ensure a consistent and repeatable setup. The phantom is machined, the Max HD is machined with a flat surface on the posterior of the head. So it will lay flat on the couch top without using any cradle. There are laser alignment marks machined, which are coincident to the center target in the brain. And to mimic a patient treatment, you can form a thermoplastic mask on the phantom in the upper right image there. And the surface of the phantom has a matte finish so that the phantom can be used with surface guided systems like Align-RT or Catalyst, either with an open mask system or maskless. And we also include a 2 elastic straps to secure the 2 halves together if you want to store it. I think we talked about the imaging ability of the phantom in CT and MRI. It does come standard with the Winston Lutz cube, anterior film cube, and posterior film cube. With the standard inserts that we included, you can deliver those to up to 4 targets. But with the optional 3D film stack cube, you can then add additional 9 targets, so total of 13 targets. So these are some of the standard inserts included with the phantom. We do include 1 ion chamber insert, which is a customer specified ion chamber. Here is the anterior film target, which is a 6x6x6 cm. And this is the posterior film target, which is 4x4x4. And we also have a central and offset Winston Lutz insert. So the Winston Lutz insert can be used by itself outside of the phantom because we have the engraved laser lines as well. And the next slide. So we also include a set of films with the phantom. So there are 5 sets of custom cut GAF chromic EBT3 films that are provided with the phantom. And we also include 10 calibration strips for you to create your own calibration curve for the batch of the film. These films are precisely laser cut and ready to use. And of course, if you require additional films, you can just contact us for additional refill packs. So this is for the ion chamber. On the image on the left, you can see the position of the ion chamber within the brain. It's in the kind of the posterior section of the brain. And we've strategically positioned all of the inserts and the ion chamber so that you can create a robust multiple met SRS plan. They're positioned far apart from each other. For ion chamber measurements, the standard, it comes with a single ion chamber cavity drilled from the neck. Again, the active volume is towards the posterior of the skull. And the ion chamber adapter sleeve can be drilled for any ion chamber type, including our W2 scintillator. Of course, we recommend for SRS, using small volume chambers. There's the XRAD in 826, and there's also the XRAD in 826 MR, which is MR compatible. So again, this is the film targets included with the insert, with the Phantom. So for the anterior insert, there's a 1-inch spherical target. You see the film, we have 2 orthogonal film cutting through the target. And then for the posterior one, there's a 0.625-inch spherical target. Again, 2 films cutting through the target. So the films are actually positioned with these dowel pins, and they're also machined with the embossed numbers. So they only fit one way, and we mark the numbers both on the film and also as well on the mating surface of the insert. So now we go on to the kind of the optional accessories you can purchase with the Phantom. So there are additional ion chamber inserts that you can also purchase, and of course you can also purchase or order additional ion chamber cavity. So an image on the bottom here. So the standard is going to be on the right, on the right, or the patient left, and the optional insert location can be on the patient right. There's also the film stack, 3D film stack insert, which includes 5 sets of custom cut films. So this has 9 planes of film, and they all fit into the dowel pins as well. So this is great if you want to get a kind of a 3D dose distribution of a larger target, or if you want to do a multiple met case, do that. The nano-def insert on the bottom right here is similar to the 3D film stack, but the pockets are instead machined for OSLDs. And again, the entire Phantom is toolless, along with all the inserts. So kind of this shows, kind of the applicability of the 3D film stack insert. So the insert is 6x6x6, and the films are spaced 5mm apart. So this allows you to do a precise multiple met SRS QA, especially for small volume targets. So just gonna go through the nano-def insert. It's another option for multiple met SRS if you have OSLDs. So you can see in the scan image here, there are 4 plates. They are machined with pockets to accommodate the OSLDs. So here's the second ion chamber cavity. You can also, of course, you can purchase additional ion chamber sleeves that go into either of these cavities. If you have multiple ion chambers that you want to use, you have that option as well. So in summary, the Max HD is a comprehensive and versatile Phantom. It can be used with conventional and MR Linux. The Phantom is fully anthropomorphic and is visible in CT and MR imaging. Max HD also comes complete with a range of inserts and multiple targets, so you can perform a robust multiple met SRS QA and be confident in starting a new SRS program in your institution. So that's my presentation for the webinar today. Thank you for staying until the end. If you have any